Last month I was at a national meeting for the American Academy of Family Physicians, and I was in a luncheon with all the presidents from across the country, and we were talking about big issues in our states. I mentioned that our state was considering outsourcing Medicaid to a for-profit, out-of-state company, and there was an audible gasp in the room because North Carolina's network of CCNC is looked upon by the rest of the country as the model for Medicaid. And everyone in the room was shocked that we would even consider that in North Carolina. But then they went from state to state talking about their experiences with outsourcing Medicaid to these for-profit companies. And state after state told horror stories of what happened to access to care, what happened to physician satisfaction, and the overall health of the state. Access to care is a very important issue for us in North Carolina. We have a lot of communities that have health disparities and outcomes that are not what we'd like to see in health care. If we limit access, if we limit the number of family physicians, if we make it in a climate that family doctors don't want to practice, we're going to hurt access to important services in North Carolina. The physicians of North Carolina are very invested in being part of the solution. We want to work together with our elected leaders to help form great policy that protects the people of North Carolina, that makes us a healthier state, and we want to be at the table. I think the most important thing to say to our elected leaders is that we need to be involved in the decision making, and we want to be involved in that process.